everyone, today we will be talking about beta blockers, which are a very common class of medications used in cardiovascular care. Our focus will be on how these medications work, why they are prescribed, and what nurses need to know to safely give them to patients. We will also compare two commonly used beta blockers, metoprolol and propranolol, to understand their key differences in practice. By by the end of this presentation, you should be able to explain what beta blockers are and how they work. We will also compare metoprolol and propranolol since they are commonly used but have important differences. In addition, we will go over some common side effects, priority nursing considerations, and key patient education points that are important for safe care. So, what are beta blockers? Beta blockers are medications that blocks beta receptors in the body. Most of the names ends in LOL, which can help you recognize them. The main effect is to slow the heart rate and lower blood pressure, which reduce the workload on the heart. They are commonly used for conditions like hypertension, angina, heart failure, dysrhythmia, and after myocardial infarction. They can also be used for migraine prevention, anxiety, and tremor, which shows that their effects go beyond just the heart. To understand how beta blockers work, we first need to understand the fight or flight response. Normally, adrenaline stimulates beta receptors and causes the heart to beat faster and stronger and increase blood pressure. This is helpful in stress situations, but over time it can put strain on the heart. Beta blockers block this signal. So before a beta blocker, the heart is beating fast and hard. After a beta blocker, the heart beats slower and with less force, which helps reduce the stress on the heart. Beta blocker work by sitting on beta receptors and preventing adrenaline from attaching. Because of this, heart rate decreases, blood pressure goes down, and overall cardiac workload decreases. Another way to understand this is through cardiac output. When the heart beats slower and with less force, the cardiac output goes down, and that leads to a decrease in blood pressure. So, overall, beta blockers help the heart work more efficiently and with less strain.
Before discussing the specific medication, it's important to understand the two main types of beta receptor. Beta 1 receptors are found primarily in the heart. When stimulated by the adrenaline, they increase the heart rate, increase the contractility, and can increase the renin release, which can raise the blood pressure. And beta 2 receptors are located mainly in the lungs and blood vessels. Their activation curb bronchodilation or relaxation of the airways and also contribute to the vasodilation. So this matters because not all beta blockers act the same way. Some are beta 1 selective, meaning they only target the heart, while others are non-selective and block both the beta 1 and beta 2 receptor. And this difference becomes especially important in the patients with respiratory conditions like asthma or COPD. Metoprolol is a beta 1 selective beta blocker, which means it mainly works on the receptor in the heart. Because of this, it lowers the heart rate, lowers the blood pressure, and reduces the workload of the heart. It's commonly used for the hypertension, heart failure, angina, atrial fibrillation, and after myocardial infarction. One important nursing point is that metoprolol is often considered safer than the non-selective beta blocker in the patient with asthma or COPD because it has much less effect on the beta 2 receptor in the lungs. That does not mean it's completely risk-free. but it generally has less risk of causing bronchoconstriction. So overall, metoprolol is often used when we want the benefit of beta blockade, while mainly targeting the heart. Now, let's look at how metoprolol works and what nurse needs to monitor when giving it. Metoprolol works by blocking the beta-1 receptor in the heart, which slows the heart rate and decreases the blood pressure. Because it reduces the cardiac workload, it can help improve the outcome in many cardiovascular conditions. As nurses, there are important assessments to perform before giving this medication. Heart rate and blood pressure should always be checked before administration. If the heart rate is below 60 or the blood pressure is too low based on the provider or facility parameter, the medication may need to be held and the provider needs to be notified. For administration, it should be given with or immediately after meals, and the extended release tablet should not be crushed. Common side effects include bradycardia, hypotension, fatigue, and dizziness. So nurses should always monitor for fall risk and symptoms of decreased perfusion. Patient teaching is also important, especially remind the patient not to stop the beta blocker abruptly. So with metoprolol, nursing care is not only about giving the medication, but also monitoring for safety and teaching the patient how to use it correctly.
Another medication we're going to talk about is propranolol. Propranolol is the generic name, and some brand names are Hemangiol, Inderal, and Inapran. It comes in PO tablets, and those can be extended release or just normal. And it can be used IV as well. Propranolol is indicated for hypertension, angina, cardiac arrhythmias, migraine prophylaxis, and the prevention of heart attacks in patients who have previously had one. It's also used off-label for some psychiatric conditions such as performance anxiety, generalized anxiety, PTSD, and akathisia in patients experiencing antipsychotic-related akathisia. Its mechanism of action is that it prevents the binding of epinephrine and norepinephrine on beta-1 and beta-2 receptor sites. So that's going to prevent the activation of the sympathetic nervous system, so that's going to look like lower heart rate, blood pressure, and reduced feelings and symptoms of anxiety. So it's a non-selective beta blocker. So it binds to beta-1 and beta-2 receptors, which are in the lungs. So because of that, you want to use caution in patients with asthma and COPD, and I'll get into that on the next slide. Some side effects and adverse drug reactions are cardiovascular, which include bradycardia, hypotension, and then because it can be used to treat arrhythmias, it also can cause arrhythmias. And then you'll want to monitor patients for a rash. It can cause Stevens-Johnson syndrome and toxic epidermal necrolysis. And then some other side effects are sexual dysfunction and fatigue. So when we're comparing metoprolol and propranolol, the main difference is that metoprolol is a selective beta blocker and propranolol is not. So what that means is that metoprolol only binds to beta-1 receptors in the heart and kidneys, so it's only going to have effects on those organs. Propranolol binds to those receptors as well, but also to beta-2 receptors in the lungs, vasculature, and uterus in people born female. So it's going to have the same effects as metoprolol, but also it's going to have more effects on those organs that I just mentioned. So because of that, we have more side effects and nursing considerations to consider. On the previous slide, I mentioned that you want to use caution in patients with COPD and asthma because it has effects on the lungs. It can cause bronchoconstriction. So patients with asthma can have exacerbations of their asthma and bronchospasm with propranolol. Propranolol can also be used for hypertrophic subaortic stenosis and pheochromocytoma. And then propranolol also interacts with statins and warfarin.
So these are some of these side effects or adverse effects commonly reported from beta blocker use. Because beta blockers can cross the blood-brain barrier and decrease norepinephrine activity in the brain, it plays a vital role in our mood and our alertness. This decrease can lead to reduced stimulation and contribute to depression. As for insomnia, beta blockers can decrease melatonin secretion, which is a key factor in regulating our sleep schedules or sleep cycles. Thus, this is how we see insomnia occur from beta blocker use. And then lastly, for sexual dysfunction, sympathetic tone is decreased, therefore impacting blood flow and stimulation. This, along with a decrease in cardiac output, leads to less perfusion and therefore impacting libido. So some of our priority nursing assessments, we want to monitor blood pressure and heart rate because beta blockers lower these two vital signs. We want to assess for hypertension and bradycardia before and after administering this medication. We'd also want to hold this medication if the heart rate is below 60. Additionally, we want to monitor intake and output, and we also want to measure our weight to assess fluid status and detect signs of worsening heart failure or fluid retention. We also want to assess the frequency and severity of angina to evaluate the effectiveness of this medication in reducing chest pain and overall improving cardiac workload. So these assessments focus on monitoring cardiovascular effects of beta blockers to ensure that this med is working effectively while preventing complications that we can see from the presentation. So some of the red flag drug interactions we see with beta blockers are that they can mask hypoglycemia, such as tachycardia or tremors, and diabetics may not recognize that they have low blood sugar. So it's important that they monitor their blood glucose levels closely. NSAIDs can also reduce the antihypertensive effect, leading to less blood pressure control. So you want to inform the patient to monitor blood pressure if used together with an NSAID. And lastly, with asthmatic patients, non-selective beta blockers can block B2 receptors, leading to bronchoconstriction, and this can worsen their respiratory status. And lastly, with patient education, adherence is really important with this medication. Skipping doses or stopping suddenly can cause rebound hypertension or worsen cardiac symptoms. So using this medication, we'd also want to inform the patient to maintain a balanced diet and to follow a healthier lifestyle change so that it can overall improve a patient's blood pressure control. And then lastly, we'd also want to start talking about orthostatic precautions and what that entails, such as changing positions slowly to prevent dizziness and falls due to the lower blood pressure that this medication is going to do. And then we have an NCLEX style question. So which statement from a patient taking metoprolol indicates a need for further teaching? Is it A, I will not abruptly stop this medication? B, I will rise slowly when standing up? C, if I forget to take my medication, I can take 2 when I remember. Or is it D, I will monitor my heart rate daily? So for this question, it is asking for a need for further teaching. So the right answer would be C. You do not want to skip dose because it can cause rebound hypertension and potentially worsen cardiac symptoms. Okay, and that concludes our presentation about beta blockers. This is our reference page. And yeah, thank you for listening. And I hope you all have a good day.